everyone, welcome back to my channel. So today we are going to be chatting about something that is super important, but most times it is swept under the rug: the 10 most common mental illnesses. We will share some insights with the hope of building a community of support. So come on, let's dive into this together and try to break the stigma one conversation at a time. American Psychiatric Association defines mental health as a health condition that significantly affects the way a person thinks, behaves, and feels. Mental illness affects the daily functioning of the person, including their work, their social life, their family life, and nearly 1 in 5 Americans experiences mental illness every single year. And anxiety and depression are the most common mental illnesses. So while some symptoms of mental illness could be mild, some of these symptoms can be really severe and debilitating. But it is just like any other health condition. It can be treated. And most of these mental illnesses can be treated with a combination of medications, therapy, and lifestyle modifications like exercise, diet, and many others. But the sad part is that only about 40% of people that have mental illnesses actually do seek treatment. So the majority of people suffer in silence. All right, let's jump into it and talk about those 10 most common mental illnesses. The first on the list is anxiety disorders. About 40 million people in America suffer from anxiety disorders every year. And social anxiety affects about 15 million Americans every year. And anxiety affects about 31% of adolescents between the ages of 13 and 18. Anxiety disorders are real and they can be serious, and they can also be debilitating. Millions of Americans suffer from daily anxiety, and it is only getting worse due to the stressful and fast-paced environment that most of us live in. Many people worry about not having enough money to pay their bills. They worry about their children going to school safely, the mass shootings, the wars all around the world, many other things that affect our communities. But let's be clear. Temporary anxiety is okay. Some level of anxiety, which is mild, it's okay, because anxiety actually helps us to stay focused and motivated. But persistent anxiety every single day, and that has been ongoing for a period of at least 2 weeks and more, can be very stressful. And more so, once the anxiety has started affecting your activities of daily living, then it is time for you to go and seek treatment. The most common thing about all these different anxiety disorders is the presence of persistent over-worrying all the time and fear. And most people that have anxiety are also diagnosed with depression. And now let's talk about depression. Depression can affect the way you feel, you think, and you function. And it causes sadness, hopelessness, lack of interest, low motivation, just feelings of emptiness almost every single day. When these symptoms last for more than 2 weeks and above, my friends, it is time to talk to someone about these symptoms. Data from the American Anxiety and Depression Association shows that at any point in time, 3 to 5% of people in America suffer from depression. The lifetime risk of major depression is about 17%. Third mental illness we're going to talk about is attention deficit hyperactivity disorder, which most of us call ADHD. So ADHD involves persistent inattention and or hyperactivity that affects the daily functioning of an individual. And ADHD is not only for kids. Adults can also be diagnosed with ADHD. And most of them have probably gone undiagnosed for many years. And some symptoms of ADHD include inattention, impulsivity, hyperactivity, fidgety, lack of concentration, low motivation. And all these symptoms affect the individual's ability to function at work, at school, at home, and even in their social environment. So while there is no cure for ADHD, treatment improves the overall functioning of the individual and it helps reduce the symptoms. And the treatment for ADHD includes a combination of therapy, medications, and education. And number 4, post-traumatic stress disorder or PTSD. About 12 million Americans are struggling with PTSD. And unlike what most people think, it is not just a thing for veterans. It can be a serious and debilitating disorder, and it can affect anyone who has experienced a traumatic event or witnessed a traumatic event. This could be war, it could be a serious accident, it could be rape, it could be a natural disaster, or a sudden loss of a loved one. These individuals that have PTSD may experience nightmares. They might also have flashbacks. They might avoid talking or going to any place that reminds them of that traumatic event. And these symptoms can lead to fear, persistent anger, shame, self-doubt, self-blame, and isolation from their peers. The treatment of PTSD includes psychotherapy, such as cognitive behavior therapy, EMDR, which stands for eye movement and desensitization and reprocessing. The next mental illness I would like to talk about is bipolar. Bipolar involves 2 different mood states, the manic phase and the depressed phase. The manic phase involves drastic mood changes, like feeling very hyper, feelings of anger, irritability, impulsiveness, outbursts, and this might last for a few days, and then the individual then becomes depressed, feels very sad, isolates, has feelings of hopelessness, low motivation, and just lack of interest. Even though bipolar can be treated, it can cause significant suffering and even mortality. The rate of suicide in people with bipolar is high. And the most difficult part of this disorder is the frequent depression episodes, which usually makes up the longer part of the illness. And most times, people with bipolar also deal with ADHD and sometimes anxiety. Bipolar is highly hereditary. It has a genetic risk of about 85%. Bipolar usually starts around the ages of late adolescence to early adulthood, and early detection usually gives the best prognosis for bipolar disorder. Treatment usually involves therapy and medications, and most times the use of about 2 medications is necessary in order to effectively control the symptoms of bipolar disorder. And it is important that family members provide support to these individuals by reminding them to take their medications and to seek treatment so that they can be able to be compliant, and that will help to keep them out of the hospital most of the time. If you would like to get more detailed information about any of these mental illnesses that we're talking about, please kindly drop a comment in the comment section. So the next mental illness that we'll be talking about now is eating disorders. Disorders can be a serious and sometimes fatal illness. It's usually related to an alteration in an individual's eating behaviors and emotions. This person can become fixated about their weight, about the kinds of food they eat, and this can lead to them to restrict the amount of food they eat, which can lead to weight loss. It can also involve purging, overeating, which can then lead to serious health consequences. Most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. This disorder usually starts around the teenage ages and sometimes even early adulthood. It has been linked to several factors such as behavioral, psychological, genetic, and social. Treatment for eating disorders involves therapy, nutritional counseling, medications, and medical monitoring to make sure that the patient's weight is maintained at a safe number. The next illness we're going to talk about is obsessive compulsive disorder, also known as OCD. OCD is a chronic disorder that involves an individual having persistent thoughts called obsessions and uncontrollable behaviors called compulsions that he or she repeats over and over again. Some people have obsessions, some have compulsions, and other people have a mixture of both. Some compulsions involve frequent hand washing, checking the doors of the house, maybe the doors to their car, numerous times over and over again. And now let's jump into autism spectrum disorders, which most people call autism. So autism is a wide spectrum and a wide variation of the severity of the symptoms. It is both a developmental and a neurological disorder, and it affects how you behave, how you interact with other people, how you think, how you learn, and how you communicate. And some of these autism symptoms start as early as age 2. And research shows that 1 in every 36 8-year-olds in the United States has autism spectrum disorder, and boys are 4 times more likely than girls to have autism spectrum disorder. It's usually a lifelong disorder and requires a lot of support along the line. Individuals with autism may suffer from a wide variety of issues, including difficulty with social interaction, and they might also have repetitive behaviors. Early detection and treatment is important to make sure that these individuals have the skills and the resources that they need to be able to function on a daily basis. Treatment of autism may include special ed classes, it may include therapy, it may include therapy known as ABA therapy, it may include occupational therapy. It usually takes a team of individuals such as the primary care, the psychiatrist, the therapist, the occupational therapist to be able to come together and collaborate so that these individuals can really get the best care that they deserve. And next up, we're going to talk about schizophrenia. Schizophrenia is a serious disorder that can cause someone to lose touch with reality. It affects the way they feel, they think, and the way they act. Some of the symptoms include psychosis, negative symptoms, and cognitive symptoms such as memory decline, forgetfulness, lack of concentration, and for the psychosis symptoms, it can include hallucinations like hearing things or seeing things that are really not there. It can also lead to depression, which is a lack of interest, low motivation, lack of self-care, and even withdrawal from their immediate community. And most of these individuals struggle with being able to perform their activities of daily living. Treatment of schizophrenia includes medications, therapy, a lot of education for the individual and the family, and it usually takes a multidisciplinary team to be able to provide all the support and resources for this individual to get the best care that they need. The last, number 10, but not the least, is borderline personality disorder. This disorder affects the individual's ability to control their emotions. It can lead to impulsivity, a distorted self-image, which can affect their relationships. It can also cause drastic mood changes and feelings from one extreme to the other. This can lead to very unsteady relationships. These individuals can struggle with ever-changing interest, impulsivity, and sometimes emotions. The main treatment of borderline personality disorder is psychotherapy. Medications are sometimes used to treat the symptoms of depression or maybe mood swings, which helps reduce the severity of the symptoms. It helps to improve the overall functioning of the individual. So if you suspect that you have one of these 10 mental illnesses that we talked about today, it is okay to go on Google and to read up to get more information about some symptoms. But most of the information on Google is not evidence-based, and it can never replace a full diagnostic eval that you can get from a trained professional. So please, if you know someone or if you're dealing with some of these symptoms, please contact a healthcare professional so that they can do a full diagnostic evaluation and assess your family history, your medical history, your daily symptoms to see if you truly might be struggling with one of these illnesses, so that they can start treatment and they can give you the proper resources and recommendations for you to be able to still maintain your level of functioning daily. And if you want more information about these illnesses we talked about, check the description box below where I've listed some national websites that provide a ton of information about some of these illnesses and statistics and the places where you can go to actually find a healthcare provider. Thank you again for watching this video till the end, and please like this video and please subscribe to my YouTube channel. And again, if you're new to this channel, I am Gael and I am a licensed psychiatric nurse practitioner, and I make videos like this twice a week. So please come back. Thank you.